Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's February 2024 issue. Our editor's choice this month is an original article entitled Temporal Association Between Vaping and Risk of Cardiac Events. It is authored by Ms. Sehe Baines and colleagues from Mayo Clinic in Rochester, Minnesota. In introducing their case series of 6 patients with sudden cardiac arrest or death, with ages ranging from 19 to 31 years, Baines et al. Point out that primary inherited arrhythmia syndromes, such as the long QT syndrome, account for no more than a minority of cases in young individuals with sudden cardiac arrest or death. Indeed, for the majority of such cases of sudden cardiac arrest or death, responsible genetic abnormalities, genetic variants, or indeed other specific causes remain largely unidentified. Within this context, it is important to consider non-genetic factors that can perturb cardiac repolarization, an electrical abnormality that can lead to ventricular arrhythmias. These factors may act in concert with each other or with an underlying genetic predisposition to induce sudden cardiac arrest or death. Such factors may include, for example, certain drugs and electrolyte disturbances and pro-inflammatory cytokines. Baines et al. Raised the consideration that one such non-genetic factor is the practice of vaping. Increasing in its prevalence, vaping exposes its users not only to nicotine, but also to various flavorings, to its vehicle composed of propylene glycol and vegetable glycerin, and to assorted chemicals. These authors were drawn to the examination of this issue based on the possibility that nicotine and other substances inhaled during vaping may perturb cardiac repolarization. In their retrospective review of 144 survivors of sudden cardiac arrest and 360 victims of sudden cardiac death, Baines et al. Observed that vaping antedated arrest in 4 individuals and death in 2 individuals. The authors are appropriately circumspect about the pathobiologic significance of this temporal association with vaping, and in their speculation that vaping may be relevant to these tragic occurrences. They also emphasize the need for much larger cohort studies so as to accurately assess the frequency of this temporal association with sudden cardiac arrest or sudden cardiac death. In speculating upon how vaping may be cardiotoxic, they offer 2 possible mechanisms. First, nicotine and other constituents in e-cigarettes may directly perturb cardiac repolarization. Second, vaping may cause acute lung injury, the latter engendering a pro-inflammatory cytokine milieu. Such a milieu may impair cardiac repolarization. The authors recognize the preliminary nature of their findings, and they specifically state, and I quote them verbatim, "The purpose of this case series is to raise awareness of the role e-cigarettes may have in sudden cardiac arrest or death, and to promote future studies to rigorously study their potentially life-threatening risks." It seems prudent to reflect on the fact that knowledge generally advances by the rigorous examination of hypotheses and apparent risks, thereby leading either to the substantiation or the refutation of such associations and hypotheses. Sounding a preliminary early warning seems justified for a possible lethal effect of vaping involving especially young individuals. This case series by Baines et al. Calls attention to the need for larger, more definitive and in-depth studies that either validate or refute this temporal association. Our first highlight article this month is an original article entitled Progression to Insulin Therapy in Patients with Type 2 Diabetes according to cardiorespiratory fitness, body mass index, and statin therapy. It is authored by Dr. Peter Kokinos from the Veterans Affairs Medical Center, Georgetown University School of Medicine and Health Sciences in Washington, D.C., and Rutgers University in New Brunswick, New Jersey, and colleagues from several other national universities and foundations. In patients with coronary artery disease, statin therapy reduces all-cause mortality and death from cardiovascular disease. Statin therapy is also recommended in primary prevention against cardiovascular disease in certain clinical settings, including in patients with type 2 diabetes. Ironically, increasing evidence has shown that statin therapy is associated with diabetogenic effects, including the progression of type 2 diabetes, such that insulin therapy may be needed. Kokinos et al. Examined the risk of progression to insulin therapy in patients with type 2 diabetes and the modulatory effects of BMI on cardiorespiratory fitness. The analysis involved data from the Veterans Administration healthcare system and included over a 9-year follow-up of these patients. Among the main findings of this analysis are the following. First, the adjusted progression to insulin therapy was 27% higher in the statin-treated patients compared with the non-statin-treated patients, and such progression associated directly with increasing BMI and inversely with cardiorespiratory fitness. Second, such patients not treated with statins exhibited a lower rate of progression as cardiorespiratory fitness increased. Third, the higher progression rates in statin-treated patients compared with non-statin-treated patients increased with greater BMI. However, this association of increased progression with greater BMI was offset by even moderate improvement in cardiorespiratory fitness. This study supports the diabetogenic effects of statins, therapeutic agents which, despite such effects, and because of their net salutary effects, are recommended for the prevention of cardiovascular disease and reduction of all-cause mortality in type 2 diabetes. These important findings of Kokinos et al. Demonstrate that even in those type 2 diabetic subjects who are overweight and obese, cardiorespiratory fitness associates with reduced risk of progression to insulin therapy. Our second highlight article this month is an original article that's entitled Machine Learning for Diagnosis of Pulmonary Hypertension by Echocardiography. It is authored by Dr. Vidhu Anand and colleagues from Mayo Clinic in Rochester, Minnesota and Jacksonville, Florida. The transthoracic echocardiogram affords the assessment of pulmonary artery pressure and thus may be used to diagnose pulmonary hypertension. However, this requires the tricuspid regurgitant Doppler velocity signal. In more than a third of patients, the tricuspid regurgitation jet is unobtainable or cannot be assessed, thereby precluding the use of the electrocardiogram in determining pulmonary artery pressure. Anand et al. Applied machine learning for the assessment of pulmonary hypertension by echocardiography. The analysis involved almost 8,000 consecutive patients who underwent right-sided heart catheterization and transthoracic echocardiography between January 1, 2012 and December 31, 2019. The training target was pulmonary hypertension as defined by mean pulmonary artery pressure above 20 millimeters of mercury by the right-sided heart catheterization. The findings demonstrate that the derived model had a high discrimination for the detection of pulmonary hypertension, with an accuracy of 82%, sensitivity 88%, and a positive predictive and negative predictive values of 89% and 54% respectively. These findings thus demonstrate that the application of machine learning to the transthoracic echocardiogram enables the detection of pulmonary hypertension and may be used to identify patients with a low likelihood of pulmonary hypertension. As such application may obviate the need for right heart catheterization, which is the next diagnostic and invasive test in determining the presence of pulmonary hypertension. The study of Anand et al. Is timely, clinically relevant and feasible, and truly innovative in its application of machine learning in diagnosing pulmonary hypertension. You can access these highlights and editor's choice articles free of charge during the entire month of February. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you will find our online-only features and many news stories posted in News from the Editor carousel on our website homepage based on articles published in Mayo Clinic Proceedings. You will see other free content as well as articles published online and in press. You will also find links to our social media by clicking the buttons at the bottom of the home page to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights and our MCP 60 seconds video article synopses. Our website also includes our Mayo Clinic Proceedings issue summary and Author Insight podcast recordings, which are available from our website on the home page as well as through iTunes. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.